Good morning, afternoon, evening, all of the above to all of you who are joining us today at this live presentation. Welcome to our 2025 Caregivers Self-Care and Tools Series number 1 webinar. I'm Delane Elliott Midland. I am your founder, president, and CEO of the End Brain Cancer Initiative, and I am your moderator today for this event. Welcome. For those of you who don't know who I am, I thought that I would just take a few minutes just to introduce myself. I mentioned I'm the founder. I'm actually the co-founder of the Chris Elliott Fund that you know today as the End Brain Cancer Initiative. 23 years ago, my late husband Chris and I wanted to help the brain tumor community, and we knew that maybe if we could help people directly when they were diagnosed and even before they were diagnosed with a brain tumor or brain cancer, and could help them have immediate access to specialists and advanced treatments and diagnostics and testing, that we believed we could increase their survivorship and quality of life. And we believe that we would be able to fuel research as well and turn that research into additional FDA-approved standard of care treatment options or diagnostics for this patient population. That's me in a nutshell. That's how I came into this community, and it is a pleasure to serve all of you within this community. It's not someplace I thought I would be, but you know what? 23 years later, here we are, and I'm very, very proud of the work that we've been doing. This particular webinar is supported by various donors, individual donors. It's also supported by Novacure. And Shreya is going to talk a little bit later in our program about the important work that Novacure is doing in the brain cancer space. We also have supporting sponsors, Great Purpose Productions, as well as WIM Social. And so today I thought we would quickly go over the agenda, and then we will get right into it. So we are going to hear today from Dr. Courtney Burnett, and she's going to talk to us about herself, right? A brain cancer patient and physician's perspective on understanding your diagnosis and accessing the best treatment options possible. So Courtney, thank you so much for being here today. We so look forward to hearing from you. Thank you. And then we'll hear from Major Timothy Gregory, MD, and he's going to talk about what is a brain tumor board and how do they work, and what is the purpose, who gets invited to this meeting, and what happens within that meeting. So thank you, Major Gregory, for joining us a little bit later. Appreciate it. And then we're going to have a roundtable discussion with all of you. We want to hear from you. And the idea is for us to talk about what is it that you wish as a patient and or a caregiver that you had been told prior to surgery or prior to your actual diagnosis. This kind of discussion is important for all of us to have, right? We want to hear the patient voice, because with that information, we get to go forward and we get to share that with not only researchers, but we get to share it with the pharma companies, the biotech companies, the biomed companies, and we get to start telling them what's really, really important to this patient community. And then we're going to share something with you. We know that drugs are expensive, right? And sometimes we need a little help in accessing those drugs on a discounted price level. So we're going to present today cost plus pricing compared to traditional pharmaceutical pricing for drugs that brain tumor patients are accessing and using that are currently offered by the company Cost Plus. And then we will have Shreya Prakash, who is here in our office. She is our patient navigator and our clinical trial coordinator. She's going to talk a little bit about her job, but she's also going to show you how to navigate to our patient and our caregiver resources section on our website. She's also going to talk to you a little bit about Novacure's website and show you how to access that if you are using the Optune device, which is an FDA-approved device to treat brain cancer. We've got a great program for you today. So what do you say? Shall we start? The folks on this screen is our mission team. So these are the folks that I get to work with on a daily basis that provides the programs and services that we have, which we'll talk about a little bit. And our programs and our services are how we meet our mission. And so we get to work every day with all these folks, as well as the folks on the next screen. Our medical advisory board helps us a lot with all of the different patient inquiries that come in and the caregiver inquiries that come in. This is our medical advisory board. We're always adding to it, and these folks help us on a daily basis as far as getting these patients in for second, third, fourth opinions, getting them into research, getting them into clinical trials, accessing genomics, et cetera, et cetera. So I always say this kind of up front. If is anyone on this screen that as a caregiver or a patient that you would like a second opinion or you'd like to be connected with, please let us know. We are happy to directly connect you to these physicians because they know that that's what we do and they would be expecting you. You can do that through reaching out to Shreya, and later on in our program, Shreya will give you all the different ways to contact her. Thank you. Next is our mission statement. It's kind of long, but basically the whole idea behind our mission statement that guides us every single day is to increase patient access and to increase treatment options for the patient population, the brain tumor and brain cancer patient population. And it is really, truly a privilege to meet this mission every single day. And how we do that, right? How do we do that? We have 3 separate programs. We have our patient disease education, awareness, and outreach program, which is something we do all the time. It's talking, it's speaking, it's putting on webinars like this, it's attending all kinds of different conferences and working with the specialists within this industry. But it's also creating patient content, right? Educational content. And it's getting that information out to the world in a big, big way. And we do that through our digital team and our social media team. And our second program, which is really a services program, is what we call our Direct Connect. And that's all of the time that we spend working directly one-on-one with patients and families and caregivers and getting them those second and third and fourth opinions, getting them into clinical trials. That's that Direct Connect program. And then everything else we kind of throw into our advocacy and our KOL program. So we're constantly working in advocacy, and advocacy is a ginormous word. Advocacy can mean a whole lot of things, but a lot of the advocacy work that we do as a patient advocacy organization is we support that work, not financially. We support that work from an advocacy organization perspective, and we provide the patient voice within those different projects. We also advocate, we work on a lot of reimbursement projects, Medicare projects, things like that. We work with the FDA on approvals. The KOL program is your key opinion leader program, and we are very proud to sit at those leadership tables often and be included so that we can share the voice of the patient. So thank you. That is basically how we meet our mission every single day. And I'm wondering if you don't know how to support our work. I always pop this up whenever we're doing a webinar or an event, just to let people know it's really easy to support our work. You can go online to our website, endbrainccancer.org, and you can donate. Or you can literally use that QR code. It's pretty easy to donate to the End Brain Cancer Initiative. And of course, you will receive a tax donation receipt. And thank you in advance for any support that you are willing to provide. So I'm wondering if you guys are ready to meet our keynote speaker. Dr. Courtney Burnett. She is very special, and we are so lucky to have you, Courtney. So thank you so much. I'm just going to talk a little bit about you, if I may. She is an MD and is a board certified internist working in hospital medicine, an assistant professor of medicine, author, and motivational speaker. She is passionate about raising awareness for brain cancer, patient advocacy, and invisible illness and disability. Ooh, I like that. Invisible illness and disability. But more broadly, she works to raise awareness of our ability to embrace all of life's difficult gifts, regardless of the cause. And yes, sometimes a brain tumor or brain cancer is a difficult gift. At age 29, while studying medicine in Thailand, Courtney self-diagnosed her brain tumor, which turned out to be an incurable and rare form of brain cancer. This radically shifted her perspective on what it means to be a patient, a compassionate physician, and a mortal human being. Courtney works full-time as a hospitalist, treating adults with a wide variety of medical conditions. She is the creator of the well-known blog Elephant Lotus Brain Tumor, and author of the award-winning memoir Difficult Gifts: A Physician's Journey to Heal Body and Mind. Regardless of the unexpected situations life brings, she believes the power of hope, mindfulness, and vulnerable storytelling can help us all find gifts amidst difficulty. Thank you, Courtney, so much for sharing your story and helping all of us today. Not just today, you're going to be helping all of us. We're going to widely distribute this video globally. Your voice is so important to hear. I just really, really want to say thank you again for sharing and being with us today. Ladies and gentlemen, welcome Dr. Burnett, please.
Thank you, Delanne. That was a very kind introduction. I appreciate it. You make me sound, whoa, I'm impressed. Thank you. Thank you.
You're welcome.
Well, as Delanne said, that's a good introduction into a lot of my professional work, but really just more down to earth. I'm a patient living with a brain tumor, and it's changed my life. And I work and I see my friends and I do my day-to-day activities, but everything is just a little bit different with that brain tumor and the history of it lurking underneath it all. So I want to keep, every time I speak to groups like this, I'm so thankful. It's such an amazing thing that even with a diagnosis, it feels great to be able to give back and share my perspective. And I'm hopeful that this is helpful for all of you today. So we'll get started. And, again, just I want to say good morning, good afternoon, wherever you're at. I'm based in Minnesota, so we're kind of early afternoon here. But as Delanne said, I'm a medical provider and I'm a patient living with brain cancer. First, I want to just thank Delanne and thank the entire End Brain Cancer Initiative team for inviting me to speak today and share my story with you all. My objectives for our time together are really very simple. First, I want to talk about how we navigate a brain tumor diagnosis, and I'll do that by sharing a little bit of my own story with you all. We'll talk about kind of how to understand that initial diagnosis, finding resources to best educate yourselves and your loved ones about it. We'll think about how to build your personalized integrative treatment team. Who should be on that team and why should they be on the team? We'll just touch the surface of comparing treatment options, thinking about standard of care and clinical trials. And think about second opinions. Do we need them? Spoiler, we do. We'll think about how we optimize time with providers. Time is always so short with a medical provider. So how can we plan ahead for our visits and really maximize our time? And then lastly, we'll think about how we can really increase our diagnostic and treatment options. Just through a quick guide, some thoughts I have through this lens of being both patient but also provider in this space. The goal for all of this is simple. And as Delanne mentioned, I think the main goal I have is how do we go from being a patient or a caregiver to being an advocate for everyone living with this illness. So we'll start by thinking about navigating a brain tumor diagnosis, which is a huge, huge topic. Now, I work in healthcare, as I mentioned, and I still find navigating this diagnosis incredibly challenging. If you are feeling overwhelmed or out of your depth as a patient or a caregiver navigating this, know you are not alone. I'll give you a very quick version of my story. As I've said, I'm a hospital medicine doctor. I live and work in St. Paul, Minnesota. I also happen to have a diagnosis of an anaplastic astrocytoma, which is a slightly rare form of brain cancer in the realm of other gliomas like glioblastoma. Now, even as a doctor, a brain tumor diagnosis is confusing, overwhelming, and very scary. This diagnosis happened for me when I was in my very last year of medical training. And it happened to be while I was studying medicine abroad in Chiang Mai, Thailand. It's a truly wild story that helped me see all of the complexities of navigating the healthcare world as a patient firsthand. I was completely amazed at how hard it is to be a patient. All of the challenges that go along with this I really hadn't thought about before. It is unbelievably hard and confusing, but I am so grateful that I had this hands-on lesson that allows me hopefully to just be a more compassionate, understanding provider with my own patients. So, just about 5 years ago, a little past that now, I was in Thailand and I started to experience what I would soon decide were these small focal seizures. Luckily, my own medical background helped me quickly diagnose these symptoms and advocate for a brain MRI while I was there. I ended up having an MRI scan and finding a tumor on that scan, which was not my favorite day of the trip. I was hospitalized in Thailand for a couple of nights and then brought on an emergency flight back home to Minnesota where I would need an urgent brain surgery. A few days later, I found myself very abruptly switching from physician to patient at exactly the same hospital where I had been working in at the time. The whole thing was surreal and was a very wild story. If you're interested, it's in a book I've written called Difficult Gifts. I won't waste our time talking about it all today because I want to get into the quick facts, the things that can help us all dealing with this, but that is there for those who are interested. With all of this, I landed myself again with this diagnosis of anaplastic astrocytoma, which is a mouthful, but it's a grade 3 incurable malignant form of brain cancer. As many of you know, there are many, many types of brain tumors, all with very different prognoses, different treatment options, and different caregiving needs. Now, no matter what type of tumor you or your loved one has, I think the fundamentals of navigating a brain tumor diagnosis are all fairly similar. So that's what I want to focus on today. At the time of my own diagnosis, I found writing to be incredibly therapeutic for me. I started a blog, Elephant Lotus Brain Tumor, from my hospital bed, which I still keep writing today. It's become this patient advocacy focused blog about navigating a brain tumor journey. I later published Difficult Gifts about unexpected gifts a brain tumor diagnosis brought me and how I found we're all really similarly navigating unexpected challenges in health or otherwise. Now, this won't be a talk about my writing or personal journey, but I mention this because I think it's vitally important for everybody dealing with a brain tumor, patient or caregiver, to have a therapeutic outlet as you navigate this new life. There's so much uncertainty that comes along with a brain tumor diagnosis, and you need something to get that out, right? Whether it's writing, blogging, drawing, attending support groups, just sharing your story somehow, I think it all helps. And sharing these stories is not only helpful personally, but is so helpful to raise awareness and hope in our community. My writing started as this little side hobby and then led somehow into a world of motivational speaking, which is how I ended up here today. I live my life now as a brain cancer survivor of just over 5 years, working full-time in hospital medicine and in medical education, but with time spent outside of that, doing everything I can to work with brain tumor foundations, cancer communities, and helping mentor others going through this challenging diagnosis. I want to support the growth of resources, awareness, and fundraising in our brain tumor world. So that's a little bit about my brief story. But luckily, after 2 brain surgeries, radiation, chemo, and some other medications I'll take for the rest of my life, I'm still here doing well with stable scans, 5 years and counting. I want to spend the rest of our time together highlighting some ideas and some tips about understanding the diagnosis and comparing treatment options. First, understanding the diagnosis. When you hear you have a brain tumor, or if you're a caregiver, when your loved one has a brain tumor, your life is changed forever. But it's okay. You have been chosen for a VIP club and you've gotten your exclusive invite. We are in this together. You likely think, how is this possible? Now, sadly, brain tumors are still very underfunded and understudied compared to many other tumor types. So we really don't know how it's possible, but here it is. I'll say on the plus side, as terrible as it is, it can't spread anywhere else once it's already in the brain. So there's that. My own morbid humor helps me get through it. You might wonder then, did I cause this? How did this come about? The simple answer is no, you absolutely did not cause it. It is random. It is bad luck. As you process this diagnosis, you'll probably wonder, is this tumor curable? Sometimes it is. Sometimes it's not. But I think about it like this. I mean, we are all living this very precious, very fragile human life, which is a terminal thing in and of itself. Our time is really limited and very precious, brain tumor or not. Many of us will start to ask, how long do I have? How long does my loved one have? We have no idea. There is no clue. I think we hear statistics, we hear prognoses, and I want to remind everyone on this call that those are just numbers. Some of the best advice I ever got with this diagnosis was any statistic that has been published in a study means that the group that statistic is based off of, they've already died. We are still here. We are not yet a statistic. So we do not know, and you are so much more than a number. I hope you never let a doctor tell you otherwise. All right, that's a lot already. I want to take a quick photo break and give you a little glimpse into my journey. So here I was in Chiang Mai, Thailand. Beautiful, beautiful place if you ever get the chance to go and visit. And I suddenly found myself hospitalized here in Thailand. I had a really interesting, different kind of hospital room than I've had here at home. But it was otherwise pretty similar. Here was on the left side, you're seeing the image I saw when I advocated for a brain MRI. And I walked into the MRI center and looked at the pictures and found my own brain tumor. And that was not a great day. But there it was, big mass in the right frontal lobe. And luckily it looks better than that now. Middle, I'm getting prepped for surgery. As many of you have seen, you get all these lovely little stickers so they can do your pre-op MRI. You see this pill box, which many of you have similar situations going on, and that's how life looks now, a little different. And then the bottom right is my really lovely colleague in Thailand who had asked a monk to stop by and help me just sort of process what I was going through with the diagnosis. Okay, it's hard to tell on Zoom, but I hope you're still awake and still with me on this journey. I want to switch gears and talk about some tips for navigating the diagnosis. In no particular order, I highly recommend all of these things. You should ask the provider diagnosing you to write down your exact diagnosis. That includes tumor type, the grade, the genetics, things like IDH, MGMT, 1P19Q, EGFR, a whole bunch of nonsense. And you don't need to worry at all about what any of this means. But having this information is absolutely crucial to getting the best recommendations. You make sure to ask for copies of your initial and all of your post-op brain images, along with medical records. It is incredibly important to keep all of these images. Now, these, as you've likely experienced, these are not offered easily to you. Usually you need to call the medical record department and request these. If you ask to sign a release of information, an ROI form, when you're in the hospital or when you're in the clinic, this can simplify the process a lot. And if you end up getting a diagnosis or you know someone who's getting care outside of their home place, like I was, whether it's in Thailand, whether it's in another state, this is especially important. So make sure you're getting these images on a disc, you're getting the printed records, and you're bringing those home with you. Next, if you need surgery, as many people do with a brain tumor, ask your surgeon to preserve a sample of your tumor tissue for future studies. This is something the surgeon should be doing automatically, and if they act confused when you ask them this question, maybe that's not the right surgeon for you. On that same note, it's helpful to find a surgeon who specializes in brain tumors. Some neurosurgeons, even though they're all wonderful, they've gone through extensive training, some specialize on the spine, some specialize on brain bleeds or other types of brain infections. If you can find a surgeon who specializes in the type of suspected brain tumor you have, likely outcomes will be better. And lots of groups like EBCI can help you find this person. Next, this one can be a touchy subject, but I recommend creating an advance directive. Sometimes this is called a healthcare plan or a goals of care document. It might feel really, really early to do this, right? When you get a diagnosis, it is not. Brain surgery is the real deal. And I would say it is incredibly helpful to have your wishes really clearly stated when you're still healthy enough to talk and write about them. This is a way we can help set our loved ones up for the future, right? I think this is a kindness to our family, to our caregivers, even if it feels sad and overwhelming. As a caregiver, keep space and time for tough conversations like this. I think it's absolutely so important to bring hope and bring positivity. But it's also important for your loved one going through this diagnosis to know that you, as caregiver, understand the reality of illness and death and how scary this is for your loved one. Ignoring it won't make it any easier. It will just postpone hard conversations. Here are a few more tips for navigating that initial diagnosis. Some that are lighter than an advanced directive, like building your team. We're going to get to this on the next slide with a lot more detail. Finding support services is key. That's going to be services for both patient and for caregiver. Information overload with a new diagnosis or even with a recurrence at any point through this journey is incredibly overwhelming. Groups like End Brain Cancer Initiative and other patient navigation networks can make this experience feel incredibly easier. Remember that the medical team you'll build can help with the key diagnosis and treatment options. But unfortunately, they don't usually have the time or all of the knowledge to educate you on every single available option. And they can't share the perspective of what it feels like to live with a brain tumor. Your medical team also might not always bring up second or third or fourth opinions, and many other resources you might need, like financial, social, spiritual support. All of those things require support services separately from your main medical team. I also think it's important to think about social media with a big grain of salt. There are a lot of really amazing and helpful groups on Facebook or other social media sites that are for specific brain tumor types. I think they can be great to look at. They can make you feel less alone as patient and caregiver, but there's often a lot of really poor medical advice shared there, and sometimes some not so helpful information. So do it if it's helpful for you, but not always. Next on this support realm, I think joining or finding local organizations can be really lovely. And this can maybe doesn't happen day one of the diagnosis. It probably doesn't. Maybe it's a year or 2 or 5 years in. But brain tumor nonprofits joining a local 5K events helps with this community. I think it helps to see how well many people with brain tumor diagnoses are doing out in the community when you're not just seeing those somber statistics or seeing people in your neuro-oncology clinic. I also recommend getting a pill organizer. That might sound silly and simple, but if you're new to daily medications, this is crucial. I recommend keeping a notebook or folder that's his brain tumor buddy. This is going to come to every single visit I have wherever I'm going for any doctor opinion. And last but not least here, take time to rest. Know that recovering brains need quiet, calm, and dark spaces. For some people, this is just post-surgery. For some people, this lasts forever, as surgery and brain tumors impact how our brains work and heal for the rest of our lives. Caregivers, remember here that it's not about you. If your loved one is maybe a little irritable or is not being the friendliest or easiest patient to work with, that means probably our brains just need a little nap. We'll get better. Okay, I want to get into building a great patient care team. Now, the person who diagnosed you, maybe an oncologist, an emergency med doc, a hospitalist, a neurologist, they are probably not the one that you will follow up with for your diagnosis. Who I want on my treatment team and who I recommend for most people are going to be the following. A neuro-oncologist. This is first and this is most important. Not a regular oncologist, not a neurologist. This must be a neuro-oncologist. Some rural communities do not have easily accessible neuro-oncologists. These providers are very specialized and a little bit hard to find. If your local facility does not have one, make sure that whomever you are seeing for your primary cancer care is connected with a neuro-oncologist and getting direct recommendations. Second is a neurosurgeon, again with a focus on brain tumors of your type if possible. Do research, ask patient networks like this one for their recommendations on the best surgeon. Some of us will need a radiation oncologist, at least at the beginning of the diagnosis. And know that your radiation team might be at a totally different hospital or clinic than the rest of your team, and that's okay. Radiation can come in a lot of different forms, and some places don't have the same devices as others. Next, I think is one that is so often overlooked, primary care provider. I'm a little biased as an internist. I think everyone needs a good primary care provider. But really, you should have, if you have a brain tumor diagnosis, that's complex. To have an internal medicine trained primary care provider is very helpful. You can't forget the rest of your body, even though your brain is in trouble. You need a healthy and strong body to get through brain surgery, to recover, to go through chemo. If you have unmanaged conditions like high blood pressure, liver dysfunction, thyroid issues, you name it, you need all of these controlled before chemotherapy. This is not only important at initial diagnosis, but if you get a recurrence. Don't neglect your body and all these other things just because the brain is stable right now, right? Keep that recurrence, unfortunately, in the back of mind and keep the rest of your body healthy. You also want this primary care doctor to help you navigate post-surgery or post-radiation things like fatigue, med side effects. I personally worked with physical therapy and speech therapy for my bit of facial droop and some weakness I had post-operatively. So that can be helpful. Number kind of 5 and 6, palliative care teams. Again, they can help with things like that advanced directive, but palliative care teams sometimes scare people. They do things like hospice, that's true. But palliative care teams also are just experts. They have doctors, nurses, social workers, therapists, experts with chronic, incurable illness of any kind. They help with a lot of support, they help with symptom management, and they just bring a whole different perspective. That I think is a really refreshing perspective compared to just talking about research and clinical trials and treatment and things you might get with your other providers. I also think it can be great if you feel the need to have a therapist or a social worker type therapist to help with you. A lot of palliative care clinics are directly connected to cancer clinics, and they'll have those services for you.
Dr. Burnett.
Yes, ma'am.
Quick question. Is a case manager wrapped up in this area as well?
That is a great question. Yes, so a case manager, different depending on the healthcare institution you work with. Sometimes within your cancer center, there will be a case manager or a social worker that's assigned to you. If you are in the hospital, that's a different person. But if you see a case manager kind of day to day, that's something that not every health service has. But certainly a palliative care clinic or an oncology, neuro-oncology clinic are probably the best places to find that type of person. Also can be very helpful.
Outstanding.
Yeah. And then kind of in the last few bits here, I think in this team, and again, 8+ people on here might feel like a lot, but a brain tumor diagnosis is usually not something that goes away in a couple of weeks. It's something you have for years or the rest of your life. And so this team can be built up slowly. But I think considering complementary medicine, that could be acupuncture, massage. Some patients with brain tumors like to undergo some types of cannabis therapy, all sorts of things. So talk with your neuro-oncologist, but these extra services can be helpful for some of us. Tumor board, I know we're going to get a great talk after this from a neuro-oncologist, but the tumor board is not something you need to build yourself at all. Your role as patient or caregiver is to just make sure that your clinic has one. Ask if there's a tumor board. They should know what that means. And if they don't, again, maybe you're not seeing the right people. And then the navigation networks, the support networks, people like those with the End Brain Cancer Initiative. These are such key resources to have on your team. Okay, I want to switch gears a little bit and really briefly compare treatment options. For benign brain tumors, sometimes that means just getting surgery or not and doing watchful waiting where you have scans every couple months or years. For malignant brain tumors, usually this means standard of care or a clinical trial. Standard of care is a little different for every type of tumor, but for most malignant tumors like gliomas, this will be surgery, radiation, some sort of chemotherapy, and some sort of surveillance after that. Clinical trials are very, very important, but also really complicated. They can be hard to find, and they can be really challenging to qualify for. I mention this because it's incredibly important to consider a clinical trial before starting initial chemo or before starting treatment for a recurrence, because sometimes you won't qualify for a clinical trial if you've already started a treatment. Now that can feel overwhelming. It does for me. But remember, you don't need to find a clinical trial on your own. That is not your job. You simply need to know that clinical trials exist, and you need to make sure that your provider offers you the chance to consider a clinical trial. So let's talk a little bit about second opinions, which is always kind of a hot topic. Keep in mind, I'm going a little bit fast through this, but I want to save time at the end for questions too. So keep your questions. You can also pause me, but we can go back to any of this. But second opinions, yes. I mean, this is easy, but yes, absolutely is my answer. I'll say this, as we have all experienced, brains tend to have their limits. Even the best providers can't possibly know every clinical trial that's available or every type of treatment option, especially with how fast science and medicine is evolving these days. Different providers also have very different sample sizes. Some of the rarer brain tumor types might be better treated by a specific provider focused on that tumor type or by very specialized clinical trials. So when it comes to a second opinion, my answer is always a resounding yes. Maybe even get a third, maybe a fourth, up to you. Know that behind the scenes, your providers are already collaborating with other people in these areas. Never feel bad or worried about getting a second opinion. This is your right, and most doctors expect you to do this. Even if the plan from your primary provider is a great one, I think having another doctor agree with that and give you that stamp of approval just brings so much reassurance to the situation. All right, so circling back to this amazing network, the End Brain Cancer Initiative, the Direct Connect program Delanne mentioned earlier is just a great example, I think, of how patient navigation networks can help with clinical trial and second opinion questions. Networks like these have navigators that can help you find lists of clinical trials you might qualify for. They can also help gather all of those really annoying medical records, all those annoying discs with MRIs, and have them sent to you or sent to a place where you want that second or third opinion. It makes it so much easier. I had a navigator, I still do, that I've worked with since the beginning of my diagnosis, who has helped send all of my scan results, all of my images to the provider I go to for a second opinion, and it's been so helpful. It saves me loads of time. I also did tell my own primary neuro-oncologist that I was going to get a second opinion, and she fully supported it. Remember, through all of this, you are never alone. There are so many resources like this to help connect patients and families to the top specialists and centers, advanced treatments, and all of these trials. Okay, let's talk a little bit about optimizing time with providers, all right? First, be prepared for less time than you expect, as we all can likely relate to. If your appointment is 30 minutes long, that probably means 5 minutes is a buffer, 5 to 10 minutes are with the nursing staff or the rooming staff, maybe 10 to 15 minutes are with your provider. Keep in mind, optimizing time is key. How do you do this? I would say you bring a list of questions. Write down your questions in advance of that appointment, and bring a paper and a pen. Take notes. With that in mind, bring a support person with you. It can be really hard as the patient to focus on the details of what that provider is saying when you're anxiously awaiting your results. Next, medications. Bring a list. Bring a list of new meds. Definitely bring a list of any supplements you're taking. Bring a list of refill requests. Those are so annoying when you forget to ask for the refill and then you're trying to call and get one down the road. It's hard. And ask about side effects you have questions on. Last but not least, sign up for any available patient portals. These are so helpful. They can be things like MyChart. They're called different things everywhere. But if there's an online portal where you can access results, that is key. This is, if you aren't sure where to start with a list of questions to bring in, the National Comprehensive Cancer Network, NCCN, makes a really helpful free printable guide that you can print from their website. The End Brain Cancer Initiative also has a link to this exact guide on the patient resources page, which I love. I've used it and it's a great template to start with. Things like, what tests will I need? Do the tests have risks? What do I do to prepare, right? Will the test hurt? When will I get my results? All these type of things. And how do you get a copy of the results with some places to take notes? This thing is incredibly helpful. Okay, I've thrown a lot of information out at you really fast, and I want to respect everyone's time on this great call. So I want to summarize very quickly over these next 2 slides some of this key information, and then we'll leave time for questions. All right, so to summarize, here are my top tips for increasing options through diagnosis and treatment. Build your ideal treatment team. That's a neuro-oncologist, a neurosurgeon, primary care, radiation oncologist, palliative care, complementary care, and all of the great support teams and navigation networks. Record keeping is number 2. Bring that brain tumor buddy, that notebook, or that folder to every single appointment. Have that online patient portal and share your access code with your caregiver or with your loved one, because if something happens to your brain someday, you might not be able to log into that. You need to have a buddy on there with you. Keep those discs with all the images. Keep printouts of any after visit summary or discharge summary that you've gotten and bring that with you. Next, I think connect really early with patient navigation networks. That can be right after a diagnosis or down the road right after a recurrence. EBCI is a fantastic place to start, but know that there are so many other great resources out there, and you can connect with them all. There's no limit. A few more tips here. Clinical trials, right? Consider these immediately and at any time of recurrence. Use patient networks like EBCI to help you find clinical trials. Second opinions. Get them. Get them early, get them later. It doesn't matter. Know that patient navigation networks can help you get these. Next point, again, keep the rest of your body healthy. See your primary doctor. Don't start smoking, please. Limit your alcohol use. Don't take supplements without asking your provider. This is crucial. I see this way too much in what I do. There's a lot of great supplements out there. There are also a lot of supplements that aren't approved and can damage your liver. And I have to tell you, your liver needs to be healthy to qualify for any clinical trial that will exist. So that is important. Last, but definitely not least, speak up. Your voice matters in this more than anyone else's. If you haven't heard back on a scan result and it seems like it's been a long time, call them, log on and send a message. You need to get that. If you're unsure about your treatment plan, ask more questions. Request a sooner follow-up. Remember that you are always in control. Your team is simply made out of expert consultants that you have asked to be with you on this journey. So to summarize, I hope that these tips help you move from patient or caregiver to advocate. I want you all to remember this. Share your story. It helps. It helps you going through it. It helps your loved ones. Raise awareness. Volunteer, fundraise, whatever you can do, especially right now. Sadly, almost every bit of federal funding for brain tumors is on hold because this is a rare diagnosis. So we need to support foundations and nonprofits that help with brain tumor research now more than ever. Next, find your community and share advice. You never want to feel alone in this. Remember that you are more than your diagnosis. Remember that hope is probably better than any medicine I can provide. And if you can, find the gifts in the difficulty. Thank you so much, everyone. I appreciate you listening to my story. My website is there. I welcome any questions now or later. Reach out to me anytime. Thank you all.
Thank you, Dr. Burnett. Wow, such great information, tidbits, and such a personal experience. And the way that you share it is really beautiful and appreciated. And I wanted to let people know that this is a global presentation, and we have people joining us today from Sri Lanka and Turkey and Kenya. And there's a lot of you joining us today from Canada. So hello, India and Slovenia as well. So wow, we've got a global presence, which we love, love, love. We have a question from someone you might know. I'm not sure. Hello, Dr. Burnett. Friday here, caregiver from Kenya. I am loving your presentation. Kindly address the following if possible. I'll just read the first one. As someone who's walked both paths, doctor and patient, what strategies helped you bridge the emotional disconnect that often exists between clinicians and caregivers?
That's a good question. And I would love to know more about that because I do think it's so personalized for each person. And so I heard emotional disconnect between clinicians and caregivers. I'm trying to think of some examples of that. I mean, certainly I think there can be maybe a disconnect if between what you're getting, if you're feeling as a caregiver like you're not getting enough information directly from the clinician. I'm not sure if that's exactly what you mean. I guess I'd love a little bit more clarity. But certainly if, for instance, your loved one is going in and you're not there at the appointment with them, there might feel like there is a disconnect. And I think part of that is just sensing, whomever your loved one is. Some of us bring our caregivers or our family with us to appointments. And some people don't feel comfortable with that. And that's a hard, I think, bridge to cross, and it's very personalized. But if you are feeling a disconnect, I think it's important to talk about that first with your loved one, I would say, because figure out if it's, do I need to come to more appointments? Am I allowed to get a call? Can I talk to your clinician directly and fill in those gaps? Right? And if it's a bridge directly with the clinician, I guess I would say just feel that you have that voice. You can speak up, you can bring your questions. If you don't feel like your clinician is giving you the right answers, you can always get that second or third opinion until you find someone that fits better.
Thank you. I think sometimes clinicians are very busy doing their job, right? And I will just say this, I think sometimes they do their job and we're maybe as a patient or a care partner or caregiver, we're looking for some more emotional support.
Mm-hmm.
But we might not be getting it because the clinician is essentially doing their job, right? They're talking about the disease, the diagnosis, the treatment options, and they may forget that there is definitely an emotional bedside manner, whatever you want to call it, component to this disease. So that might be more
Yeah. What that means,
what
that
this
makes a
comes
lot,
up.
and that certainly, I see that, I felt that. I think that that is in a lot of ways provider and caregiver or patient specific. Just what support do you need? And again, if you're not getting it, different providers will have different degrees of that emotional connection with you. But you're exactly right, Dylan. I think there is, unfortunately, there's a time limit. I'm not sure how it works. I know you're in Kenya, the person who asked this question. So I'd love to hear more about that. But depending on where you practice, I mean, time in the US for a provider is really, you're pushed not only by the place you work, but by insurance, by all these factors. You have a very limited time. And as much as that emotional support is needed and that extra time is needed, that's why it's so important to have this whole integrated team. Or maybe when you see a palliative care provider or your therapist, maybe then you have the 90 minutes that you need to talk about and get that emotional support.
Excellent. Excellent. I think social workers as well play
Absolutely.
a big part of this. Alexandra, are you joining us today from BTN? So just to let everyone know as well, EBCI does not employ a social worker only because we don't have resources specific for that. But we do have a partnership with the Brain Tumor Network, who does employ very valuable and experienced social workers that we can connect you with. So just know that too on that side. Another question, in low resource settings or rural areas where neuro-oncologists and most of the specialists you mentioned, where'd they go? Oh, whoops, it just disappeared. Sorry. Can you see those, Dr. Burnett?
Yeah, I think I'm seeing this one. It looks like
Okay.
some places where those specialists are
I'm
scarce,
scared. Okay.
how can caregivers best advocate for diagnostic clarity? Good
Okay.
question. And certainly that's the case in a lot of the world and a lot of rural communities especially. And I think again, this is where it helps to get connected with navigation networks like and Brain Cancer Initiative. Because even if maybe you don't have a neuro-oncologist or a very specialized surgeon for miles and miles, if you can get your case shared with that doctor, a lot of providers will offer virtual visits. So even if you can't see them in person, there may also be resources to help with financial support to help you travel to see a provider that's outside of your area. So getting involved with networks and just being very honest. I mean, asking the provider that you do have they treated this before? If they have not, to ask them, hey, who do you think we need to loop into our treatment team? Usually providers will be upfront with how many times they've done something if they feel like they need to connect with someone else for help. And that should not be fully in your hands, but also in your providers, right? If a provider knows I need extra support from someone more specialized in this, they can also behind the scenes help set that up. So it's just kind of making sure you're aware of that and asking for it.
Fantastic. We have a question that came in from a family member. They're caring for a family member and they've been caring for this person somewhere between 1 and 3 years. And it says, how to have meaningful conversation, how to not put my stress on the patient. how to
Mm.
support other close family siblings. And that is a really tough question, but I bet you can answer that.
Ooh, that's a big one. I'll
Uh-huh.
do my best. I guess, I think some of the onus is on the person living with the tumor. I mean, certainly, right? As a caregiver, I love that you're asking this question because it shows the love and support you have for the person going through this. But certainly, the person with this illness has to be in a space where they're okay talking about these things. And that's different for everybody. I can say just from my own, personal situation, I find it helpful that the more honest I can be with my loved ones about how I'm feeling, what I need from them, is important. I think what helps me to be honest about those needs is for my loved ones to check in. Even if you've had, for me, example, I've had 5 years of fairly stable scans. That doesn't mean that there's a day I wake up and brain cancer is not on my mind. It's always there. And it's easy, I think, especially on days that look really good for loved ones, for caregivers to forget about that. So just to remind, to think maybe it's once a month, it's every couple weeks, whatever, check in with them. Ask them how they're feeling, ask them if they have new symptoms, ask them if they just want to talk about it. I think just making space, just making it okay to talk about this maybe more often than you feel they need is really helpful.
Excellent. Excellent. We have a family member is caring for a brain tumor or brain cancer patient, and they've been caring for them between 1 and 3 years. Their question is how to cope with professional obligations, parental obligations, and caring for the loved one that is sick and not losing oneself along the way. Ooh, that's a
Mm.
super good question. Probably everyone here can relate to that question.
Hmm.
Any advice?
That is another wonderful question. And let me think how I can best. I mean, to be frank, I am not a caregiver, right? I mean, I am for other people with other conditions, but for myself, I am seeing this from the patient side of things. But certainly when I think about who I've worked with in the medical field, other caregivers I've worked with for my own patients, I mean, it is so important to take care of your own health, right? All of these tips apply to you too. Take time for your brain to rest. Find your own therapist if that's helpful, right? Find your support team. And that might look different. That might be social support groups, that might be navigation networks, social media, what have you. But I think finding other caregiver groups, people to talk to who've had similar experiences, talks like this today, like there's a roundtable I think coming up. I love that idea. Just to share what you need. And sometimes maybe that's with your loved one, but I think also having those support groups, having those conversations when your loved one's not there. So you can be honest, you can be open, you can talk about what you need. I tell my husband, I tell my parents, I'm sure there's a lot under the surface that you're feeling with my diagnosis that I don't know about or you won't share with me. So go get coffee, go talk about it together because that's really important.
Very important. And along those lines, I will just be really honest and say this as a caregiver, please do not feel guilty for the time that you do take for yourself because it's necessary. Caregiving is not for wimps. And sometimes it takes every core of your being to be a exceptional caregiver. But you do need to refill and replenish and do not feel guilty about taking that time away from your loved one to do whatever it is you want to do, that will help you and replenish your soul and your energy because you will be just a better caregiver. And truthfully, in the long run, your physical and mental health will be much better. Caregiving's hard, but what you don't want to do at the end of the day is jeopardize your own health and weaken, your own systems because you were caregiving so strongly. And
Yeah.
and honestly, I think a lot of us when we're in the middle of caregiving, we probably don't think about that. We're very, very focused on caregiving. So just know it is okay to get away. It is almost like it should be part of standard of care, to be honest, for caregiving, because you have to. So just know that And that will look a little different for every single caregiver. We have a comment by Jonathan Zung. Dr. Burnett, as a drug developer, we often find it challenging to increase awareness of clinical trials for oncology patients. In certain CNS tumors, it appears more patients are being seen and treated in the community hospital setting versus AMCs. Any thoughts on how to drive awareness for individuals and caregivers who live in the community and want to be treated within the same community?
Yeah, thank you, Jonathan Zung. That's a great question. I actually give full keynotes on this question.
Oh,
So I don't think I can summarize that quickly, but would love to talk more about it. But yes, I mean, so whether you're at more of a community setting versus a big academic medical center, an AMC, where these trials are held, for the most part, it can be very different. And how do you make people aware of it? My very brief answer is there have to be ways, I think, to get to know your patient's story. Who are the patients you hope to enroll and how do you reach them? And that's different in every community. And that might look like making sure we have flyers, we have information in the local, more rural or community-based oncology or even primary care clinics. It looks different, whether it's just sharing resources, whether it is making sure big patient navigation networks like EBCI and others know about all of these trials and can direct people to it. Yeah, I think that's a hard one. But I guess biggest tip is understanding the patient perspective and their limitations. Why aren't they able to do this? Is it a financial constraint? Is it that they can't do this? They have to be hospitalized for a month to go through this clinical trial. They can't afford it. They can't get to it. There's a lot of things I think, and knowing who your patients are, where they're coming from, and what they want out of that trial is vital.
thank you, Dr. Burnett. We have a lot of questions, but I do want to get to one more. And I want to say hi, John Williams. It's been a long time. How are you? I hope he's still here. He says, thanks, Stellan and team and Dr. Burnett. This is a wonderful service for patients. Question: what is Dr. Burnett's opinion on the potential use of chemosensitivity testing of resected brain tumor tissue as a standard of care? Very good question. You were talking earlier in your talk about knowing,
Mhm.
is your tumor tissue IDH1, IDH2, MGMT, what is all the stat? Okay, so here's a cool moment to elaborate on that.
Mhm. Well, let me start by saying I am not a neuro-oncologist, so this is out of my scope. What I can tell you is that maybe this could be a great new thing in standard of care. And I can tell you that the more testing we have on chemosensitivity by helping people get involved in clinical trials to test these things, the more likely it will become part of standard of care. But as for if it should be, I can't really speak much to that yet, to be very honest. But I think having that data is the first step to figure out if this can be something that insurance covers. Unfortunately, that can be something that is easy to do for all, people going through this surgery and getting the testing. Is there a centralized source for it? All those things I would need to ask a neuro-oncologist or researcher about.
Yes, and so standard of care is very slow to respond to science. It's about 10 years behind. And so if you ask the In Brain Cancer Initiative as a patient advocacy organization, yes. Comprehensive genomic testing should be standard of care and it should be covered by whoever, right? So it's research information. So it could be covered by the hospital. It could be covered by your provider, health insurance. It could be covered by Medicare. We're starting to see some shifting in that area through a lot of advocacy work. So we're starting to see more coverage and we're starting to see a little bit of standard of care for a few biomarkers, things like that. So that's a first step. So it's really, really great that we're starting to see that shift. I have no doubt that we eventually will get there where comprehensive genomic testing will become part of standard of care. But I can tell you as a care partner or a patient or a caregiver, it does help to ask for it continually because you will be heard, right? When you're at a community setting or you're at a doctor's office or you're a surgeon and you keep asking the question, they do hear you. They do hear you. And the more you can ask, the better it is because that creates advocacy movement, and eventually movement changes policy and standard of care. So, keep asking. Everyone should keep asking for more and more information, more and more comprehensive genomic testing, and more coverage for it as well. That information is really, really important, by the way, out of those tests, because that's a lot of times that's what's used to qualify you for clinical trials, right? For targeted therapy. So you have to have those tests and you have to have that information in many, many cases to qualify for specific clinical trials that probably would make scientific sense for you based on the information within your brain tumor tissue. Dr. Burnett, I want to say thank you so very, very much. I'm looking, let's see here. So this is a good question, and we'll have to end it here, and we'll move on to our next speaker. This one is from Friday again, and she says, as someone who is actively transitioning from caregiver to advocate in a resource-limited setting, what advice do you have for balancing personal grief with the public responsibility of advocacy?
That is an important and tough question.
It is a hard question.
Again, because it's subjective. It is personal. Grief is personal, and how much of that and in what ways we feel it's impossible for me to put myself into what you're feeling. But I guess I would answer this in a very broad way of, this is a bigger question than just brain tumors. I mean, think about grief through anything we're all facing, whether that's financial or social or political, and how do you balance that with advocacy? Because advocacy is so important in so many different areas, right? Brain tumors certainly included. And gosh, if we can answer that one, I think that's magic. It's beautiful. I wish we could answer that one. I think to just know that again, is, thinking back to like, how do you care for yourself as caregiver? To be an advocate, but to also not let it be all consuming. To do what you can, but realize that I think of it like an empathy battery. And I have so much empathy to give. I can do so much with sharing this story, with advocating. But at some point, that battery is drained, and I have to just focus on myself. And that's for patients, that's for caregivers, that's for advocate. So just find that balance, I think, even if it's little ways, whether it's, again, signing up for that local 5K or sharing a post on social media about fundraising. It can be that small, that's still advocacy. So do what you can, but if it starts to feel like you are overcome by emotion and your battery is short, take a break, right? There's only so much we can do.
Yeah, great advice. Thank you so much. Really appreciate that. Dr. Burnett has agreed to personally sign the first 10 books, the first 10 people who registered for this webinar and provided their mailing address within the United States will receive a personalized signed book by Dr. and author Courtney Burnett. I want to thank you so much for doing that. I'll get you that information. I have read Courtney's book, and I believe everyone should read it because it's true. We don't think of brain tumors or brain cancer usually as a gift. And so she has a different perspective. And so I think it's well worth reading her book as well. Dr. Burnett, a real pleasure. We got to meet many years ago in Tampa at a Brain Tumor Network event at the Society for Neuro-Oncology meeting. And I think it's there where I picked up your book, and I've had it, and I only, read it probably 6 months ago. But it's a gift, and it will be a book that I continually have within my library of books and that I get to share with people who I feel like are in need. So thank you, Dr. Burnett. Have a great rest of your day in Minneapolis or St. Paul.
Yeah. Similar. Thank you. Thank you, Dylan. That is very kind of you to say. I really appreciate this. Again, right, a gift, brain cancer, brain tumors, doesn't always feel like a gift, but it's things like this. I get to be here with all of you today, sharing stories and helping advocate and raise awareness for this community. And that is a gift in it. And all of your questions were gifts. So thank you so much. I appreciate it and hope to be in touch with many of you. Take care.
Thank you so much. Thank you. Sean is going to pop up a slide. It's a slide that you've seen already. It is our medical advisory board that we work super closely with our medical advisory board to help us when patients come forward if we do not know exactly how to help them, or we don't know personally the PI for a particular clinical trial that they look like they qualify for, or we don't know based on wherever they live in the United States exactly where we should be making a personal introduction for them and pre-qualifying them for advanced treatments, diagnostics, and clinical trials. So I showed the medical advisory board slide again because up on the top row, 1, 2, 3, 4, 5 over, you will see a picture of Major Timothy Gregory, MD, who is our guest speaker for today. And he is going to be speaking about tumor boards, what they are, what is the purpose, and who are all those people involved in the tumor board, and what are they doing getting together talking about people's brains. So we are going to put up an introductory slide for Dr. Gregory. And I'm just going to give you a little information. Dr. Gregory has spoken before at our Caregiver series. I believe it was last November, so thank you in advance. He is not only a medical advisory board for the End Brain Cancer Initiative, but he also sits on our scientific advisory board as well. So a very big thank you for your expertise in this area. Thank you, Dr. Gregory. He began his Army career with an enlistment in the Pennsylvania Army National Guard in 2009, and then currently attended his undergraduate studies at the University of Pittsburgh. He was commissioned to attend USUHS in 2013 and was inspired during his rotations in both neurology and oncology. He graduated in 2017 and he proceeded to Madigan Army Medical Center for his neurology residency. Madigan is based just outside of Seattle, Washington. Through outstanding mentorship and generous support from Army leadership, he went on to a 2-year neuro-oncology fellowship at MD Anderson Cancer Center in Houston, Texas, after which he received orders to return as faculty at Madigan Army Medical Center. While building up a brand new brain tumor program at Madigan with a clinical research focus, Major Gregory's primary academic interest is medical student and resident education. He is the only military neuro-oncologist on the West Coast and is actively leveraging telemedicine across the neuro-oncology in underserved regions, including Alaska and Hawaii. I should mention that he is one of either 2 or 3 neuro-oncologists in the United States serving our active military and our veterans. And with that, welcome.
Well,
Dr.
thanks so much,
Gregory.
Joanne. I appreciate that introduction. So it's awesome to be back. Like you said, we got to discuss scanxiety for my last venture here, and it was really cool to have that discussion that day. This, by the way, this is a hard talk to follow. That was an amazing talk by Dr. Burnett. I really enjoyed that. And I was sitting here thinking, I hope I'm one of the first 10 that signed up for the registration today. So I'll definitely be tracking down that book. That was a really great talk. So much good insight there. In September or November, whenever last session was that I was here for, we brought up while we were kind of talking about that anxiety in between scans and, the fear of progression of the tumor and everything, that kind of brought up, it would be interesting to talk about tumor boards a little bit and how they work. So I'm very excited to share my perspective on the brain tumor board. This is the neuro-oncologist's point of view. I've benefited from participating in a few institutions now over the past several years, and the biggest of which was MD Anderson as a fellow. So it's been nice to kind of see how a really good academic center's tumor board works and kind of inform my practice going forward. That's where a lot of, it was really great to present to that team and be part of the discussion, but kind of sit back and really hear some of the best in the world talk about how they would approach some of these difficult problems. So happy to lend that perspective today, and this can be just kind of a little peek behind the curtain of how that goes, and I welcome any questions. And if we didn't clarify the term, if you're not too familiar with tumor board, this is really just speaking to a regular meeting among the various specialists that should be occurring on behalf of the individual patients to make the best recommendations for the treatment plan. So, starting with the why, I'm sure everybody is here who is here is aware cancer care can be very nuanced. There's no one size fits all for any individual patient. And so the goal is to assemble this multidisciplinary team to encourage discussion amongst the specialists and try to come up with some kind of consensus on what will bring about the best outcome. So this gets everybody on the same page, aligns everybody in this fight against the individual's tumor. And in some cases, the tumor board can be helpful to clarify the diagnosis. Sometimes we need to hash that out with all the available data. And then other settings, it's, really important that we discuss any applicable guidelines. But as everyone may be aware, sometimes those guidelines fall just a little bit short for rare brain tumors, and we have to rely on expert opinion to inform the best steps. So that's a really important part of this process as well. And then finally, we've heard some really important, ideas about the clinical trial participation and everything so far today. That can be another huge goal of the tumor board, is kind of making sure we're not overlooking anything and maximizing participation in clinical trials. So hopefully there's some regional insight of what's available and what we can be pointing our patients towards when we have these discussions and get them plugged in. So the bottom line is, just trying to personalize the safest and best case scenario plan for each patient. So I've listed here kind of the core of the tumor board. I've bolded, of course, the treating oncologist, the neurosurgeon, the radiation oncologist, and then it's really nice if there's a radiologist and a pathologist with expertise in neuroimaging and neuropathology. I would say those are probably the really essential voices to make sure we have a quorum for these meetings. But then other experts are very welcome. It's very appreciated when we have engagement with palliative care. Case managers, of course, very important. So they're tracking what our goals are. I've seen neuropsych, geneticists, and even ethicists have had a really interesting role. You never know sometimes what background dynamics are involved with individual families, and there's always a backstory. So sometimes ethicists and financial assistance, everything involved can be part of a really good tumor board. So, and then I'll just kind of point out the trainees are kind of the backbone too. Sometimes, don't be surprised if you're getting your care at a big academic center if person who knows you best is a fellow. And so they're sometimes really well equipped to be talking about the case to the tumor board and representing the important details there. And this is also a really cool mechanism for the experts with all the experience to be kind of passing along a lot of their expertise to that next generation of oncologists. So another really important job of the tumor board. They used to look something like this. Maybe some tumor boards still look like this. In a nice conference room, there would be coffee and snacks, and it was kind of not social hour, but it was a get together and in a very collegial experience. And it still is. The pandemic changed a few things for how we meet, and in some cases for the better, of course. We now have national tumor boards that look just like these Zoom meetings. And that's great. Maybe we've traded some coffee together for now we can have meetings across, like the entire VA system, for example, has a national tumor board that we have access to. So some really, really great opportunities to bring in experts from anywhere nowadays. So that's kind of what it's looking like these days. So I tried to pull up what impact tumor boards are actually having on outcomes. There's not a lot that I could find in the brain tumor space, as you might expect, but we can extrapolate. There is some work in the breast cancer literature, and it does look like a not insignificant amount of diagnoses can change as a result of these discussions. And there is definitely a signal of survival benefit from having these discussions. So just like Dr. Burnett said, it's good to have that question with your oncologist, is there a tumor board? And, that's an important mechanism to make sure that your institution is able to participate in. So just kind of laying out the general workflow, usually treating provider or the person who knows the patient best is going to present the case, give the relevant details, and then kind of gets handed off to radiology. They'll screen share. We'll look through the images together. That's important for going through the anatomy of, where the tumor is located, but also sometimes if there's any diagnostic discrepancies, we can get some information just from the scans alone. When available, the pathologist will then go ahead and review some slides. It's really nice for us to go through that together and get anything out of the way, like any molecular testing. We talked a little bit about those genetic tests, how essential those are now for defining a lot of tumors and a lot of our treatments. And so that's a big part of it. And then, after a few minutes of that, we have the diagnosis and everything as clear as possible. Then each expert is given an opportunity to weigh in, and we kind of try to come up with some kind of consensus on what we're going to recommend back to the treating team to deliver to the patient. I thought it'd be helpful to give a few common scenarios. And this actually kind of arose. We were kicking around, how could we make a mock tumor board happen? That would have been really cool. But for now, we'll kind of walk through a few scenarios. These are very recurrent questions that come up, and so helpful to, know when you might be coming up for discussion if you're involved in a tumor board. So it's not uncommon for example, for the neurosurgeon to bring up a newly discovered brain tumor to the tumor board. So very commonly, somebody will come in with new neurologic symptoms. This is probably old news to much of the audience here, but new symptoms will lead to some kind of scan, and then that scan will get handed over to a neurosurgeon, asking, what do we want to do next for this? And so it's really helpful for the neurosurgeon to present to the tumor board at this point in care. Sometimes this will clarify the diagnosis just a little bit to give insight, how soon do we need to pursue a surgery? How aggressive should a surgery be done? Sometimes it does make sense to just watch and wait and then make those decisions over time. So that can be a big part of the discussion. I've also seen the neurosurgeons really benefit from discussing with their colleagues who also do the surgeries on the best approach. They have a pretty hard job. I don't envy what the neurosurgeons do. Their goals are often in conflict of trying to get as much of the tumor out as possible while not causing any neurologic side effects of the surgery. And so these are very thoughtful discussions, trying to make the absolute best decisions of just how to approach. So that's one example. Another common scenario is in the immediate post-op setting when we're trying to develop our treatment plan. So this is a chance to review with a pathologist what it looks like under the microscope. And, the molecular results and some of the special tests can trickle in over a few weeks. So sometimes this is maybe a 2 or 3 week delay after the final, to get the final integrated diagnosis. But that's a good time to be sure we're all on the same page with the molecular markers, any special tests, predictive testing when it's available. I know that was a question that came up, and kind of aligning that with the latest guidelines. So I'm showing here, these are kind of the Bible of how we define tumors, the World Health Organization's classification. And it's always being updated because we're always getting new clarity on how molecular markers are impacting what we should be doing. So we're probably due for another update for now, but we're on the 5th edition. And so tumor board is a good chance to make sure we're appropriately defining these tumors, and then that can help us to select sometimes targeted therapies, and at the very minimum, just knowing exactly what we're treating so we can be very precise. And then another important scenario, this is the one that's most likely to keep me up at night, is, when is the tumor progressing? So for a lot of you on the journey, you might have been part of these discussions where it's hard to confidently answer, has the tumor progressed? Sometimes the scans will give subtle changes. Sometimes the changes can be confused with either radiation side effects or surgical changes. And so we have to put together all the data and as a team try to select, try to make a confident decision with some uncertainties sometimes mixed in. But that makes our job a little bit difficult. It's hard for everybody because we want to be really thoughtful with our timing of selecting the next treatment and then making sure that next treatment is the absolute best option. So we can try to turn to specific guidelines, pointing out this is the NCCN. They have some nice guidelines for many tumor types. They're just not as robust for some of our brain tumors that we treat. Unfortunately, some of our brain tumors we're dealing with kind of small numbers, and for our common brain tumors, even like glioblastoma, we're still seeking the most superior ways to do second line treatment for these. So sometimes, again, we're left with, let's get the whole team together and make sure, consider all options in front of us. And that's actually pretty much what the guidelines say. We should be making sure we're considering if radiation or another surgery would be appropriate. They build in the suggestion, consider a clinical trial. And so we have to consider all of those options and really try to pick the best strategy. Sometimes it is another chemotherapy as well. So that's kind of the nuts and bolts of what's going on at your institution's tumor board, at varying levels of scale, depending on how many providers are there. So yeah, just kind of the bottom line here is it's our mechanism for making sure we're all coordinated on the same page and enhancing as much access to clinical trials and care as possible, trying to create those personalized recommendations, reducing any chance of bias or overlooking any options that we should be talking about. And then just to kind of emphasize, the tumor board is there really to recommend, not necessarily to dictate. So they'll give some recommendations back to the treating provider, which will then probably come up either in a phone call or in the next clinic visit to discuss, with all the stakeholders, the family, and try to take into account all the goals and make the absolute best plans. So with that, that's me and my boys at the top of Mount Adams. That's kind of what I do for fun. And I welcome any questions or comments. I really appreciate everybody's attention.
Thank you so much, Dr. Gregory. That's a great photo.
Thank you.
You practice at two separate places. When do they hold their tumor boards typically?
Yeah, so Swedish is my part-time opportunity that I do up in Seattle. That's where I get to take care of civilians outside of my military setting where I'm full-time. Their tumor board, very robust, meets every Monday morning, and usually there's a pretty nice size list. Madigan has more of an ad hoc tumor board, so we assemble, we're basically assembling that pretty much on a weekly basis, more or less, but it's not necessarily as scheduled, just as the volume dictates.
Okay. Has that additional neuro-oncologist been trained?
And so we have one neuro-oncologist in the pipeline in the DoD. He holds acceptances to multiple amazing fellowships, and if everything goes well, he will begin that fellowship next summer. So more to follow on that.
That's amazing. Yeah,
Yep.
that's really great. I mean, I bring that up. I've got a list of questions to ask you. That some questions came in when people registered, and then there's some that are coming in online right now. But it's really important for anyone who's listening today to know that Major Timothy Gregory, MD, he's able to work with all active military personnel as well as veterans in the United States, no matter where they live. So that's really, really important. He's not as restricted as many other neuro-oncologists are in the United States as far as who he gets to work with related to geography. So I share that because it's so, so, so important. He's an amazing resource, and we can pop up his contact information again while we talk about some of the questions that have come in. Oh, this is such a good question, Lyda. Thank you. I kind of had that same question. She says, Dr. Gregory, is there any discussion about how to better include patient perspectives in the tumor board process?
I love that question. That's, yeah, so vital, important for the patient to be very central to the discussion. And, it doesn't escape me that the patient is generally not there for the tumor board. So really important to have your goals and your family's situation and goals very well established with treating provider. They're going to be the best to advocate for patient's unique situation. And that is usually very central, to kind of taking into account all those things like family situation, functional status, goals of care. That should all be kind of embedded in that tumor board discussion. But if there's any details that the patient would want the treating oncologist to bring up, that's very important for those initial visits. Highly encouraged.
I know as a patient advocate, I've asked to be included in some of those tumor boards across the United States before, and I found it very informational. And it really helped my understanding because then I was better able to convey what happens within those tumor boards to patients and to their care partners. I guess I want to clarify, patients are usually not invited to attend their tumor board.
Correct.
Okay.
Usually it's a meeting, and maybe a big part of it's just the HIPAA compliance because we're discussing maybe a list of patients and that sort of thing. Yeah.
Understand. Understand. I appreciate that. So this is a question which is, a big question. It came in from, this person says, the question is, who do you care for? Myself. So this is actually from a patient also, and it asks, what are the cutting edge treatments and clinical trials? I will assume this is a brain cancer patient. I don't know that for a fact, but that's how I would probably approach that question.
Well, that's a loaded question. We're always working on finding the cutting edge, and I'm trying to involve myself in that space as much as possible. So there's a lot of great ideas that are circulating and some things on the horizon. There's a lot of interest in, figuring out how to rev up the immune system to go after the tumors. And you might be hearing more about immunotherapy, CAR T therapy in the coming years. There's all kinds of vaccine-based trials and a lot of great ideas for I'm assuming, maybe talking about the biggest one, glioblastoma is getting a lot of attention, of course. But yeah, we're always looking for the next best thing. And there are still, thankfully, a little bit of congressional funds kind of being shunted towards some research. I sit on a panel that is looking into that from a peer-reviewed standpoint. We just had our recent meeting to go over no fewer than I had responsibility for 35 different proposals for research proposals, and there were some really exciting ideas there. So stay tuned. We try not to get discouraged, but this is the side of cancer care that keeps us as oncologists energized, because we know we can get better, we can push that bar higher, and that's what we're continually fighting for. I hope that answers the question. Feel free to.
That really, really helps. I feel, to be honest, I feel like, wow, if we just talk about GBM right now, I've never seen so much research going on in this disease space in the 25 years that I've been around in this space, specifically GBM. It's pretty exciting. And we do know the research financial situation is just tough. But believe us when we say there is amazing research going forward. It just needs funded, but the interest is there, right? So I don't want patients and families and caregivers to feel like alone and that we only have standard of care as choices. I want you to know there is a lot of research going on. There's a lot of clinical trials in the United States that are open and enrolling. And if you need more information on that, you need to get a hold of us, because we can certainly pre-qualify you for those clinical trials based on your medical records and your genomics, comprehensive genomic testing, et cetera, because it takes, this is a tough disease. It takes all the tools that we have. So Dr. Gregory, right now, can you talk a little bit? Most people will be aware of this, but there's a reason I'm asking. Can you talk about, if we just talk about GBM, standard of care right now today?
Yeah, so the standard of care, as far as FDA approvals, has not evolved a ton since I started practice, and frankly, since the years leading up to that. So we're still searching for the next best standard of care, and I think it could still be some years before we see some unified FDA approval for something that's going to apply to everybody. But I can say we are, despite that limitation, we are getting much more insight as to the biology of the disease. We've learned so much in the last decade about the different molecular parameters and, genetics, immuno landscape, all of that. And so we are, I think, going to be more and more equipped here over my career to personalize our strategies. And that's where we need a little bit of grace from the insurers out there who don't really understand why we might select an off-label therapy. It's really hard to say this should be on label when it only applies to a select number of patients.
But you can prove it.
Exactly. And we're getting much more equipped for that. And that's the direction we need to go.
Absolutely. And, Shreya's going to talk about this a little bit later too. We're living in a world today where we have the very first device to treat GBM, FDA approved. For goodness sakes, You know what I mean? That was approved in, I think, 2011. We're moving forward with different treatment options, targeted, but also options for everybody for this disease. And I just think the advancement is really encouraging. The other thing that I never want to leave a conversation not saying is wherever you're being treated, know that there are other additional treatment options likely that you would qualify for. And so there's just no way that one institution, one hospital, one academic center can have everything available to everybody. So you sort of have to know that those are your tools. Everything that's going on that's available to brain tumor and brain cancer patients at every location, those are actually your tools. And so you need to be able to access all those tools and know that most of them are actually available to you on some level. You know, you can enter into the clinical trial, or you can have other kinds of access into clinical trials. And that is also a great sweet spot of the End Brain Cancer Initiative. We can help you with that. So I just wanted to say that this is something you can address. It's different than your talk, really, but if you don't mind, this is someone who's caring for a family member. What is recommended treatment for recurrence? I'm going to assume it's GBM.
Yeah. So we wish we had good guidelines for that. And, just to reiterate, another one of the really important scenarios for the tumor board to kind of weigh in on, because sometimes the answer is going to be, for recurrence, we need to consider, is it safe to go in and get a little bit more surgically, kind of hit the reset button in that way. Sometimes if there's been a safe time frame and the location of it is good, sometimes more radiation. There are a handful of chemotherapies that come up recurrently for progressive GBM. Some of them easier to tolerate than others, but because it doesn't seem like one is particularly superior to others, and in a lot of ways, sometimes clinical trial can make the most sense. And that's actually kind of built in as, we should be thinking about a clinical trial if available for the right patient. So I know that's not a concrete answer for you, and I'm sorry, but that's kind of the dilemma that we individualize for each patient.
Yes, yes. In this particular disease, it makes sense almost, well, I think it makes sense to have clinical trials as part of actual standard of care.
Yeah, and the NCCN even kind of recognizes that. So, yep, if the clinical trial is available, that is definitely a worthwhile pursuit.
And that goes back to something Dr. Burnett was saying too, which is, if you are working with a neuro-oncologist who is practicing at a community hospital or a rural setting, please be sure and encourage them to be working with a specialist at, a brain tumor center of excellence or an academic center, just so the access is there and different things can be brought forward as potential treatment options. To her point, not every neuro-oncologist is going to know about every single thing, one, but two, they're just not going to have access to it wherever they're practicing. But if they're partnering on a patient's care, it increases treatment options, it increases access, that kind of thing.
Yep, completely agree.
Yeah. How do you feel like when you're working with patients and their families and caregivers related to the tumor board? How do you explain, do you ever feel they feel a little bit alienated or a little bit, well, wow, why am I not included? Or do you ever get any comments or questions like that? I'm just curious.
That would come up sometimes. So sometimes patients kind of want to know the details of the discussion. We try to capture that a little bit. So usually somebody's documenting the tumor board discussion at some level, so it's nice to be able to speak to that if there were any, dissenting opinions and that sort of thing. So yeah, I like to arm my patients with as much information as possible. And so I'll have a very transparent discussion. Well, the perspective from radiation doctors was that we should maybe consider this, but the perspective from, my thought is this, and I want you to be informed and be able to kind of take that and do what's best for you. So Yeah, I try to make sure everybody has as much information about the thought process as possible. That definitely takes a little bit of the burden off.
So I hear you saying you do share with your patients and their families the discussion that went on in the tumor board, right? Yeah, and even if there's I call it a discrepancy, but that's not the right word. Even if there's not total agreement, right?
Yeah, exactly.
Um,
Usually, these tumor boards are usually very, very collegial, but certainly, yeah, there can be room for, the different lanes to kind of have their thoughts. So,
does someone ever say within a tumor board, well, hey, this patient would be exceptional and a great candidate for X that's going on at wherever, MD Anderson, UCSF, I mean, wherever, right? Does that ever come up in these discussions?
absolutely, I try to keep a pulse of what's going on and keep up with some colleagues about what's available.
Awesome.
Some patients it makes sense. Hey, let's take a trip to Houston and see what's going on there. That's not a one size fits all either of, I don't want you to get stuck there for 6 months if they're going to have you do a really busy trial, but it's definitely worth considering and knowing those.
That makes sense. That makes a lot of sense. Quickly, on MD Anderson, I don't know if you can answer this or not, but I know you have quite a bit of experience there. What's the right word? They're developing all of these different, which is great, satellite medical centers, I guess I would want to say, across the United States.
Yeah.
Are these sites, are they feeding people to the large MD Anderson and Houston clinical trials, or is the goal to actually be able to provide clinical trials out within these satellite sites as well for the brain tumor, brain cancer community?
That's a really good question, actually. I'm not too sure, what the absolute latest is. I
We'll
know
find out.
yeah, I can definitely look into that.
Okay.
Yeah, there were a handful of satellites throughout the greater Houston area when I was down there, and I know they're in a period of growth, which is very exciting. So, um, yeah,
Yeah,
I would
they
expect
really, really
all of you
are.
to get
Yes.
basic.
Yes. That. Well, thank you for joining us today. Does anyone else have any questions for Dr. Gregory? All right, let's wrap. I still want to work with you on the mock tumor
Yeah,
board. I have some ideas as we've discussed. You know what I mean?
I
I
love it.
think we can get some others involved as well, which might be kind of a great idea, right? Just to
That sounds really cool.
Yeah,
Like a really
yeah.
good resource
So let's think about that. Our next caregiver series, self-care and tools, will be on November 7th. That's a Friday as well, same time, same format, but maybe we can get it together for then. Because I just think it would be for all those people that are visual people and visual learners, just to sort of be a little bug on the wall and get to see what this looks like, right? We now know who the key players are for the most part. Good, good. I see Brian will volunteer his case for
You
a
have
live tumor
volunteered.
board. Awesome. Thank you. Thank you, Brian. Thank you, Lida. That would actually be great. But, I just think that kind of thing is really valuable because I don't want anyone to feel excluded, right? These are specialists coming together for a patient case, and there are different things that they discuss, but it kind of might be interesting. So let's work on that.
I love it.
Okay,
Pleasure,
thank you.
Deland. Thank you very much.
Happy Friday.
You
Have
too.
a good one.
You too. Okay.
Thank you so much. Thank you. Right now, what we wanted to do is just literally open up a discussion. We always want to hear from caregivers and patients as well. But in this particular session, this is really about caregivers. And we want to know from your perspective, your voice, what is it that you wish you had been told prior to surgery, like your loved one's surgery, or prior to their diagnosis? When I say diagnosis, I do mean not, yes, they have what looks like a primary brain tumor, but literally this is after the pathology report has come back. Is there anything that really stands out for you that you wish had been a conversation before you either had to come across it yourself or think about it yourself or had to ask the question to the neuro-oncologist or even the neurosurgeon, really? Is there anything? We're just curious from a patient advocacy perspective, and we might be able to dive into what you say a little more at another caregiver series session. So if you have any ideas, I can't see you, so I can't see if you're raising your hand or not. Do feel free to, if you can, take yourself off of mute and go ahead and feel free to ask a question or talk or put it in the chat session. That would be great.
Hi, Diane, it's Lida.
Hi.
I think one of the biggest things for me, I was just talking with somebody about this the other day, who is on the front end of a different cancer journey with her spouse, not brain cancer, but it applies. You get this plan after the diagnosis, you're going to do, this amount of radiation and this type of chemo, and it's going to go on this schedule. So you have this idea in your head, it's all going to go like just so. And stuff starts to happen and things kind of go sideways and you can't quite like follow the plan. And I think, when that happens, you just start to feel very sort of panicky, out of control. And I wish somebody had told me on the front end, it's not going to go perfect. And that's okay. And it does not mean all doom and gloom that if you have to take a break or readjust or rejigger the schedule. Like, that's something I just really wish I understood better on the front end.
That makes sense. And I totally get that, right? Because I know that there's panic that goes in when your platelets are low, you can't have your chemo, you have to wait. You start thinking about, well, gee, I'm pausing my treatment, and I'm worried about that. And it literally causes panic attacks. So really, I agree, Lida. It would be wonderful if we were told some of those things. Let's see. Carol says, I was told by a small community hospital that we had 20 minutes to make a decision to have my husband get the tumor removed. I intuitively knew that that wasn't a good decision and had to push hard to get us released and transported to a research university. We wish we knew it wasn't an immediate emergency in the moment. So I hear you and I get that. Most brain tumor diagnoses are not an emergency situation in the moment. There's 5% that are actually emergencies and they do need to have surgery right away. But what was just shared is the majority of people being diagnosed with a brain tumor today in the United States, they go to their local ER because that's what most of us do. We don't know that there are specialists. We don't know that. And we kind of learn all of that. And so Carol was a huge advocate to her husband because she just knew she had to get someplace else. And and it was hard to get him released and transported. I assume you mean by ambulance. But yeah, that's a very difficult thing. I hear this all the time. I understand it. But as a patient advocate of your loved one, it's okay. You literally just have to be strong in what you want to happen. You're not there to make anybody your friend. You're there to get the best possible medical attention for your loved one. And so you have to be really, really strong and you can't be rude, you can't be obnoxious, that kind of thing. But you definitely can be very, very strong in what you want for the patient. And it's easier, like if it's a spouse, it's easier to do that than if you are a friend or of somebody or in a relationship and you're not married. It becomes harder when you're not a spouse. But you have every right to make those requests and to make sure they are carried out. Lori says we would have liked to have had information about clinical trials prior to surgery. Ooh, I hear you. We felt pressured because of severe symptoms and urgency for the surgery. But we now know that there were immunology trials prior to the surgery And those trials were at where you had surgery, right? So yeah, I mean it's kind of interesting that the discussion doesn't happen all the time right before surgery related to clinical trials because it's simple paperwork that has to be signed right before surgery to end up having access to additional tumor tissue or access to treatment options. And so those are good things to ask, even though, of course, none of us knows this until we go through it, right? But that's the question, like prior to surgery, what kind of clinical trials do you have available here? Can we learn about them? Can we sign the paperwork ahead of time? That kind of thing. And do know that you almost always have more time than the community hospital is going to tell you. They usually give you steroids, bring down your swelling in your brain, and they usually schedule surgery within 72 hours. Do know that you almost always have more time. So it's practice, but it's not, what's the right word? It's practice and it's a guideline for physicians to have that surgery within 3 days. But do know that you, as an advocate, you can ask for other things. You cannot go along with the plan, right? I think it was Lida that was saying, kind of told what the plan is going to be, and it's quickly told to you, and you're kind of in shock and all of those things. But do know that you get to be part of the plan, even though it doesn't always seem that way. And sometimes it's not, you're not really invited to be part of the plan, but you do have a voice. And so definitely use that voice. And then we learned that when you sign up for the standard of care, you may become ineligible for some clinical trials. So knowing the questions to ask is critical. So that is true. I agree. We're going to actually cover some of those resources that we offer along these lines also on our website in just a minute. Shreya's got a great little presentation to help everybody understand. There's a lot of things you can ask prior to surgery, and we have some of those resources on our website. So right now, I think what we'd like to do is I'm going to introduce you to a company called Cost Plus. And it is a company that Mark Cuban created to address the issue of the high cost of drugs that all of us face. So Cost Plus offers generic drugs for all different kinds of diseases, and you can purchase them online. I wanted to give you an example. Right now, some of the brain tumor, brain cancer drugs that they are offering and what the price difference is. Cost Plus is a company that doesn't use a lot of money on marketing, right? And the drugs that they offer changes all of the times. Want to be sure I'm really clear on that. But like right now, if you were wanting to pay less money for Timidor, right? You could get it through Cost Plus and for literally $46.10 a month compared to what other pharmacies are charging, which is literally $3,363.60 plus a month. So I want everyone to know that. So Cost Plus, you can go online, literally sign up, and you can start getting your drugs for less. When we researched this company, I don't know, 3 months ago, we had a long list of drugs that brain tumor and brain cancer patients are often prescribed. And so when we did our, fact checking a couple of days ago, we noticed that they've gotten rid of a lot of those drugs, and these are now only the drugs that they offer. So I would say check back often to Cost Plus because it is constantly changing out. The drug methotrexate is actually for the PCNSL community. Just know that. Most people are put on Dex when it is discovered that they have a brain tumor to bring down the swelling as well as after surgery. But, take a peek at that. I mean, look at that. The Timidor one is really incredible as far as the price difference. I just wanted to make everyone aware of that particular outlet. And then in November, when we do our caregiving, self-care and tools series number 2, we have another company that is offering discount drugs as well. There's actually 2 more that I know of, but we'll share about one of them. And we'll keep doing that every time we do a caregiver series. So that would be great. Okay, so without further ado, I think we would like to introduce Shreya Prakash. Shreya works here within our National Patient Services and Support Center, and she is our patient navigator and our clinical trial coordinator. So she's here 5 days a week. She also opens up a couple of evenings a week to have calls with patients and caregivers and care partners. And so she's very, very busy helping people find additional treatment options, clinical trials, diagnostics, resources for patients and caregivers. So Shreya wants to take a few minutes just to share a couple of different things with you. Shreya, you have the floor.
Thank you, Dylan. First, I'll talk about Caregiver Resources Center we have. I have listed a couple of the things that we have in the Caregiver Resource Center. Family caregiving, we have also books, videos, and podcasts if that's something that you're interested in. Mental health resources, financial and legal issues, some materials and information about financial and legal issues that you might have some information about that, and then some technologies about caregivers also, and some what I mean by that is like some app like Dr. Burnett had mentioned about some like pill organizers. So we have a list of those informations as well, and some ideas for legacy projects as well. And I will show you where to find this Caregiver Resource Center in our EBCI website in a minute. Before I share the Caregiver Resource Center, I just want to quickly share the discount prescription program that Dylan was talking about before. So this is where we have the fact sheet. It is under the resource tab right here. And we will be constantly updating that fact sheet as well as we, as they include more drugs in the list, Cost Plus does, or if they remove drugs as well, we will update that fact sheet. So it will be under resources, discount prescription programs. And then our Caregiver Resource Center is right here as well. This is where all the information that I was talking about is listed. In the drop-down menu, you'll have all this information about family caregiving, and then here's a list of some collection of books in our EBCI bookshop that is related to caregiving, some caregiving videos and podcasts as well. And then this is about related to technology for caregivers that I was talking about. So devices and apps, applications. This will take you to a list of some devices for like pill organizers or some apps that will help you get your day-to-day life organized better, so you can keep track of all the appointments you have for your patient, and then just make your life a little bit more organized, because with all the appointments and everything, it just gets very unorganized. So I think with all these apps, it will just help you get more organized basically. My NovoCure is a support program that NovoCure has launched maybe a couple months ago. In this support program, they have all this information about Optune Geo. If you are just starting Optune Geo or currently using Optune Geo. So there are like all these different ways you can use this platform for insurance support, or if you want to talk to someone else who's currently using Optune Geo, and if you want to get first-hand feedback from them on like what are some of the side effects they are facing, so that if you want to know that if it's a good treatment for you or not. I will show you my NovoCure app. So this is the My NovoCure support program, and they have 3 tabs right up here. So if you're recently diagnosed with GBM, and if you just heard about Optune Geo, and you just want to learn more about it, this is where you want to first go, the very first tab, recently diagnosed with GBM, and learn more about it here. And then about GBM, about what Optune Geo is, some education and resources sites. And then if you have decided you want to get Optune Geo, this is where you'll go, starting Optune Geo. If you click on it, this is where you'll go, which is like getting support. Once you click on this, it will lead you to start chatting with device specialists. You'll chat with them, and then they'll get you connected to like a doctor or like a specialist to get all the information that you need to basically get moving to get you the device you need.
And I would also say, Shreya, if I may,
Yeah.
Optune Geo is FDA approved. It is the first device that is FDA approved to treat GBM and recurrent GBM. Most places do offer access to Optune Geo. It's through a prescription, essentially. But if you are being treated by a provider that has not brought up Optune Geo as a treatment option for your brain tumor, your brain cancer, please bring it up, one. Or two, if you would like help accessing this particular treatment option, you can go to Shreya, or you can go directly to this particular website, which is now on our, I believe it's on our website as well, or there's a link? I think there's a link.
There's a link, I think.
But the idea is increasing patient access, right? And this is a treatment option that is FDA approved for patients. So there's all kinds of information out there. We just wanted to make you aware of it. But if by chance it hasn't come up and it hasn't been a discussion with your provider, do bring it up. Or if you would like increased access, you feel free to work with Shreya to help you, or feel free to go to this website as well.
So this was about Optune Geo. So it's very focused to Optune Geo. Here's the schedule, Optune Geo buddy. So you can talk to someone who is using the Optune Geo device already and just get first-hand information about how their experiences are with this device, and if they have any side effects or any other information that they would like to share with you. Yeah, and then another thing I would want to share with you is the patient inquiry form. So this is the patient inquiry form right under Take Action. So this form, it's a very short and simple form that you want to fill, and it will, once you fill and submit this form, it will come to me and I will reach out to you. You can, in this form, you will just tell me what you need, what information you're looking for, if there is anything in this caregiver resource center that you're not able to find. You just, feel free to just fill this form out. And once I stop sharing my screen, you'll also have my contact information as well. So just can use that also to, reach out to me. Just tell me what you're looking for. So looking for what resources you're looking for, any information I can help you find. And I will be more than happy to reach out to you and, help you get that information. Feel free to reach out to me through this patient inquiry form, or email, or call, or text. So I will share those with you in the chat as well. And then you'll have it on your screen when I stop sharing. Thank you.
Outstanding. Thank you, Shreya. Really appreciate it. Yeah, people really need your help with personal navigation. Getting those second, third, fourth opinions from specialists is so very important. And a lot of what Shreya does too, just so everyone knows, she will gather your medical records, your genomic testing, pathology reports, all of those things, and she'll read them, she'll understand them. She'll start thinking about clinical trials that she's aware of, and she'll start doing a deep dive through clinicaltrials.gov. She will identify clinical trials that look like you are a candidate for, and then she'll discuss those with you. And then once you decide which ones you'd like to pursue further, she'll introduce you directly to either the principal investigator of that trial or the site that is closest to wherever the patient lives that has the trial enrolling. Do use her services and her expertise, because she's amazing and she helps to increase patient access. So we have a slide, and it just advertises our November 7th Caregiver Self-Care and Tools Series number 2. And that is going to be on November 7th at 11 a.m. Pacific Standard Time. It'll be kind of the same format. Registration is open for that particular event. You can scan the QR code right in front of you. Of course, you can find it on our website, and feel free to register. Registration is free through, of course, are amazing sponsors that help support our services and programs. And for this particular event, I want to thank Novacure again for sponsoring our Caregiver series for 2025. And I also want to say thank you to our donors who support our webinar series as well as all of our programs and our services, as well as our supporting sponsors, which is Great Purpose Productions and WIM Social. So it's been a pleasure spending some time with you today. Drea has put in her contact information within the chat, so please take a peek at that. And she's available Monday through Friday, 9 to 5 Pacific Standard Time. She does open up two evenings a week to speak with patients and caregivers, care partners, to help them as well. Please feel free to contact her directly or fill out our patient inquiry form, and that allows us to reach back out to you and to help you. Thanks, everyone.